Welcome to my channel, RX Sam 2020. Today we discuss a drug named Metformin. About is the main first-line medication for the treatment of type 2 diabetes, particularly in people who are overweight. It is also used in the treatment of polycystic ovary syndrome. It is not associated with weight gain and is taken by mouth. Metformin is a biguanide antihyperglycemic agent. It works by decreasing glucose production in the liver, increasing the insulin sensitivity of body tissues, and by increasing GDF-15 secretion, which reduces appetite and caloric intake. Medical uses: maturity onset, non-insulin dependent, obese diabetics, in whom diet alone has failed. Very unstable juvenile or maturity onset, non-insulin dependent diabetics, where a combination of insulin and metformin is beneficial. In those diabetics where sulfonylureas and metformin, when given alone, fail but a combination works. What is metabolic syndrome? Is a clustering of at least 3 of the following 5 medical conditions: abdominal obesity, high blood pressure, high blood sugar, high serum triglycerides, and low serum high-density lipoprotein, HDL. Polycystic ovary syndrome, or PCOS, is the most common endocrine disorder in women of reproductive age. The syndrome is named after the characteristic cysts which may form on the ovaries, though it is important to note that this is a sign and not the underlying cause of the disorder. Lactic acidosis refers to a lactic acid buildup in the bloodstream. Lactic acid is produced when oxygen levels become low in cells within the areas of the body where metabolism takes place. Diabetic ketoacidosis, DKA. It is a life-threatening problem that affects people with diabetes. It occurs when the body starts breaking down fat at a rate that is much too fast. The liver processes the fat into a fuel called ketones, which causes the blood to become acidic. Dosage. Type 2 diabetes mellitus. Adult. Initiate therapy slowly in order to minimize adverse gastric events. Initially, 500 mg 2 times a day or 3 times a day or 850 mg 1 to 2 times daily, may increases dosage in steps of 500 mg at intervals of at least 1 week. Maximum 2.25 g daily. Polycystic ovarian syndrome. Adult, initially 500 mg daily in the morning for 1 week, then 500 mg twice a day for 1 week, then 1.5 to 1.7 g daily in 2 to 3 divided doses. Elderly. Doses may need to be reduced by around a third in elderly patients. Monitor renal function regularly. Child greater than or equal to 10 years. Initiate therapy slowly in order to minimize adverse gastric events, initially 500 or 850 mg once daily. Increase doses either weekly by 500 mg daily or every 2 weeks by 850 mg daily to a maintenance dose of 1500 to 2000 mg daily in 2 or 3 divided doses. Contraindications: renal failure, cardiovascular collapse, diabetic ketoacidosis, severe hepatic insufficiency, pregnancy, lactation. Special precautions: patients should not consume alcohol as there is an interaction between metformin and alcohol which could lead to an increased risk of lactic acidosis. Metformin should be temporarily discontinued for 48 hours in patients undergoing radiologic studies involving intramuscular administration of iodinated contrast materials. Drug interactions. Drugs cannot be taken with metformin. Carbonic anhydrase inhibitors, such as acetazolamide. Corticosteroids, such as prednisone. Blood pressure medication, such as amlodipine. Anticonvulsants, such as topiramate and zonisamide. Oral contraceptives. Antipsychotic drugs, such as chlorpromazine. Side effects. Common side effects include diarrhea, nausea, abdominal pain, gastrointestinal, GI, tract disturbances. Tolerance is a person's diminished response to a drug. Vitamin B12 deficiency, prolonged use. It has a small risk of causing low blood sugar. Some brand names which are available in the market: Bigomet, Glucofage, Glycifage, Glycomet. If you want information on a particular medicine, mention it in the comment section. Thanks for watching. Please subscribe, like and share.